On August 29th of the year 2005, a Category 3 Hurricane Katrina struck the southeast Louisiana coast. What you're looking at now is the 17th Street Canal levees. Short time after Katrina came in, these levees were breached. Some of them were hit by barges, and other ones just by excessive water. Hi, I'm Dr. James Bissland, and welcome to May's edition of Health and Information. And today we're coming to you from New Orleans, Louisiana. One of the things that prompted me to do the presentation here this particular weekend is the city of New Orleans is a bowl, and it averages about 8 feet below sea level. Now, when these levees behind me here, they hold the water back as it comes from Lake Pontchartrain. Lake Pontchartrain is just straight up that way, just a short distance. As the water rose in Lake Pontchartrain, the levees that were broke by water pressure, these canals here, this is the 17th Street Canal, the water rose up and put the parts of the lower 9th Ward here in New Orleans under about 20 feet of water. Now, the reason that I go into this discussion is that this tragedy struck New Orleans almost 7 years ago. But now, when we look at the whole picture, it had far-reaching effects. The storm didn't just affect New Orleans, it didn't just affect Louisiana, but in fact Texas, Oklahoma, Arkansas, probably the majority of states across the United States took refugees, sent care packages. The Red Cross came from different parts of the country to be able to help the people here in Louisiana. And it had a tremendous effect on people everywhere, no more so than right here in New Orleans. Now, when we talk about the city of New Orleans, as I said a minute ago, it's in a bowl, and it averages about 8 feet below sea level. And the question that always came to mind when I first started hearing about that is, why did they build a city 8 feet below sea level? And my second question was, if it's below sea level that's close to water, how does the water stay away? Well, there's two ways. These levees right over here are one of the ways that it stays away. The levees are there to protect the land, and if you go straight across those levees and those homes there, the water level was just about up to the top of these levees. So you can see that people, as we remember watching the video on the news, so many of these people were being rescued by boats and by helicopters, and they were standing on the roofs of their houses, which of course those houses are no longer there. As we drove along the street just to the left of the levees here, it's amazing. All new houses are built, but I have probably never seen worse streets anywhere. So we look at the city of New Orleans, and it's a bowl 8 feet below sea level, and even if the levees are all intact and all functioning, how do they keep water from accumulating after a storm? Across the street right here, we see a pump station. The pump station continually pumps water out of the underground areas of the water system and the sewer system, and pumps that excess water back into the lakes and the canals so that it keeps the land dry. One of the things that got me to thinking about how this relates to what we do as far as healthcare goes is New Orleans could not survive without these pumps that are across the street. The city would be inundated with water and all the things that come with floods on a regular basis. Kind of like our heart. Our heart pumps blood to all parts of our body and keeps the blood away from, or keeps it from pooling in like our legs and our feet, and that prevents us from having health issues. And it's the same way basically with the pumps here in New Orleans. The pumps will keep the water away and keep the city healthy. Our heart pumps the blood through our bodies to give us the nutrients and nourishment we need, but also the heart pumping will keep our blood from pooling in the muscles. Now, the second factor that I looked at in relating this to how our bodies work is a pinched nerve in one part of the spine, or a pinched nerve in one part of the body for that matter, can have far-reaching effects. For instance, a pinched nerve in your mid-neck can cause you to have hiccups. Now you'd think, okay, somebody has hiccups, you want to look to the diaphragm. Or you might want to look at the stomach. But in fact, the problem is coming from a cranial nerve called the phrenic nerve, which has some of its origins in the mid-neck. The top two vertebrae of the spine, the atlas and the axis, C1 and C2, control virtually everything from that point down in the body. So a problem in your foot, a problem in your leg, can in fact be caused by a problem in your upper neck, and what they call the upper cervical spine. And this is why, as a chiropractor, one of the things that I do is I continually look at the spine as a whole unit, top to bottom, so that we can determine exactly what's going on. We can determine where the cause of the problem is, so that when we do a treatment, it's going to be effective. We look for far-reaching things, and this is why somebody will come in and tell me they have a pain in the foot. Yes, I might look at the foot, but I look also at what caused the problem in the foot. Is it actually a local problem to the foot itself? Is it a nerve problem, a spinal problem that might have come from the pelvis, or come from the low back, or come from the mid-back? Or is it a very upper cervical spine, C1 and C2, that might have caused the problem in that particular nerve? When we think about nerves, if we look at these wires here over the electrical wires, and we see these all the time in our houses and our telephone cable wires and so forth, but inside of those wires, inside of those cables, there is multiple little teeny wires, and each of those wires has a final destination. And our nerves work the same way. If you take and you get a cross section of a telephone cable, all you see is a bunch of wires, hundreds or thousands and tens of thousands sometimes of wires. And this is the way the spine is, so that the nerve that ultimately ends up going to your big toe actually originates in the neck. But if you go back even further, it originates in the brain, comes down through the upper part of your neck. Now, if we have a significant misalignment, a significant subluxation or a pinched nerve, or a torquing or twisting of these vertebrae in that upper part of the spine, it will interfere with the spinal cord from that point down, as well as if it interferes with that particular nerve that goes to your big toe, you're going to have problems with the big toe. By looking at the whole spine, we're able to make the determination as to how the problem was created, where was it created, how long ago was it created, and what is it going to take to get it corrected. And that's what, as a chiropractor, that's what we do. We're going to be right back after this message with more information from New Orleans.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected where Marie
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected with Murray Electric.
Welcome back to Health and Information for May 2012. I'm Dr. James Bissland, and we're still coming to you today from New Orleans. After we did our segment, the previous segment, we did some more kind of touring around, and we went to down to the lower 9th Ward, which was the strongest hit area of New Orleans in the hurricane, where houses were 20 feet underwater. And it's amazing, after even almost 7 years of deterioration following the hurricane, that some of these houses were still standing, but they were very, very deteriorated. And the sad, even more sad part about it is that there were people who were still living in some of these houses. As we toured through the hurricane areas, the one thing that struck my attention more than anything is the damage to the streets and the roads. And that kind of got me to thinking about what happens to our spine as we get a trauma and don't do anything about it. And I have a guest who's going to come and talk with us today. Those of you who have followed our program before have seen this young lady on with us before. But from Maysville, Kentucky, I'd like to welcome Dr. Rita Goldman. Thank you for being with us.
Well, it's my pleasure to be here. Thank you so much for having me.
I asked Rita to come talk to us today about what happens after a trauma or a long-standing spinal misalignment with a nerve interference. What happens if it's left untreated? So I know you got some good stuff to tell us because you do your radio show every week and you talk about this stuff all the time. So have at it.
Thank you. Yes, we talk to patients about this because this is something we see on a daily basis, especially when we see someone's spine in their neck when they've lost the curve. One of the first things we'll ask them, I feel like I'm CSI of chiropractic, is what happened to you? You've lost the curve in your neck and you have all this degeneration. Just last week I had a young lady in the office who's in her early 30s who was in a bad car wreck, and she'd never been treated after the car wreck and had these huge spurs that had formed. Now, spurs are a form of arthritis because the spine's trying to link together, and it was pinching the nerve in the neck. The nerve in the neck came down her arm, and it was affecting her hands, and as a result of this, she was developing carpal tunnel. So everything is connected. This young lady is still young, okay, and I want to thank you for calling me young, but but this is what can happen to you, not only in your neck, but in other parts of your spine. The body will start to degenerate. Okay, the disc will get narrow, and the disc are the cushions that are between the bones. You'll start to get adhesions, you'll get spurs, you'll get pinched nerves. So we'll see this in people that have had injuries to the low back. They'll develop sciatica, they'll develop neuropathy. Okay, they'll develop where they don't have the use of their legs or their hands. They'll start to develop a curvature. All these things are going to age you prematurely. So the wonderful blessing about chiropractic is it's going to keep you young and healthy and going. James, thank you so much.
Thank you, Rita. One of the most important things that I got out of kind of touring around here in New Orleans is this city got traumatized. The city got traumatized drastically by probably the worst storm that's ever hit here. And one of the most important things that I saw that happened is that with all the repairs that they've had to make, the areas that they haven't gotten done yet are just continually deteriorating. And it reminded me of a movie about what happened to the earth after we're gone, you know, all the deterioration that took place. And it got me to thinking that the more and more and more that we let our spine go. The more and more we let our body go and don't maintain it, the more problems we're going to have. It's kind of like our vehicles. If we don't maintain our car, they're going to break down. If we don't keep our tires rotated and balanced, they're going to wear out. If we don't align the front end of our car, our tires are going to wear out. We're not going to have our car taken care of properly. If we don't change the oil in the car, the engine's going to ultimately have a problem with the valves or the gaskets and the head gaskets. And all of these things are the same as what we do with our patients every day. We want to get into treating and correcting these problems while they're minor, or correcting them as soon as we can after the accident to prevent the deterioration and degeneration that Dr. Rita was just talking about. So I want to thank all of you for joining us this month. We hope that you've gotten something out of this presentation, and we have a lot more guests lined up for the next couple of months to give you more information. And until next time, I'm Dr. James Bissland. Have a safe, healthy, and happy month. We'll see you next month.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You wanna talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected with Marie Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.
We'll get you connected with Marie Electric.
Are you in pain? Then meet the doctor. Neck pain, headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic. headaches? Meet the doctor. Low back and leg pain? Meet the doctor. Arm, shoulder, and hand pain? Carpal tunnel syndrome? Meet the doctor. Injured in an auto accident? Meet Dr. James Bissland at Bissland Chiropractic, where you can get your first visit free this month. Call Bissland Chiropractic at 838-4252. Bissland Chiropractic.
Where were you when the lights went out? Who did you call and when you gave them a shout? Did they pick up the phone? Did you get a machine or some front office drone? You know what I mean. You want to talk to somebody who knows what they're talking about. So call Marie now. Electricians with a mission will get you connected. We're Marie Electric.
Hi, this is Larry Murray with Murray Electric. We appreciate your business and we don't take you for granted. While nobody likes to have electrical problems, we want you to know that we will be here for you when you do need an electrician. And remember, you don't get phone shuffle when you call Murray Electric, because we have a real live electrician that answers the telephone. Remember, if you're in a hurry, call Murray, 918-835-9605. 918-835-9605.